Welcome to Alpha Coding Podcast, an all-access pass to medical coding and billing pro tips that help you start your week off smarter. And now, here is your host, Toni Elhoms.
Hello, everyone, and welcome to the Alpha Coding Podcast series. I am your host, Toni Elhoms. Welcome to episode 34 of the podcast. Today is August 24th, and I'm excited because I invited a special guest to join us, and he's a big player in the telehealth space. So if you're looking to get in the know on digital health in 2020, you've come to the right place. Before we dive into our topic, it's time for your Monday dose of positivity, the Mindset Monday tip, and it's brought to you by Contempo Coding, which is an on-demand educational resource provider created for coders by coders. They specialize in affordable coding certification prep courses to help you accelerate in your career. Right now, they're offering $100 off the Certified Risk Adjustment Coding Prep course when you order through our affiliate website. Visit our website, alphacodingexperts.com, and head over to the Deals and Discounts tab for a link to take advantage of this absolute steal of a deal. So our Mindset Monday tip is all about viewing your mistakes as stepping stones. The quote I want to share with you says, "Don't carry your mistakes around with you. Instead, place them under your feet and use them as stepping stones." And I think this quote is really powerful because as humans, we all make mistakes. None of us are perfect, and mistakes are part of the journey. It's important that you are aware of that, you embrace that, and view your mistakes as the stepping stones to learning and growing. You are going to fail. You're going to make mistakes, and you're going to make some big mistakes, and you're going to want to put your head down and sulk about it, but you want to take those mistakes, you want to put them under your feet, you want to learn from those mistakes, forgive yourself, and just look at those losses as great lessons. So that's what it's all about, changing your perspective. So our guest for today is Aneel Irfan from Irfan Medical Supplies and Technologies in Miami, Florida. Aneel is a national telehealth expert, an ambassador, and a fellow entrepreneur. He also hosts the 10X Healthcare podcast. I invited him on the show today to discuss his best pro tips for navigating digital health in 2020. So thank you for joining us today, Aneel.
Hi, Toni. Thank you for having me. Happy to be here.
Absolutely. So talk to us about what's going on in digital health right now.
Wow. I mean, COVID has really been a landmark event for digital health, right? We've really finally seen, in my opinion, the validation of digital health tools in our healthcare system. It's really the quintessential tipping point, many would say, for virtual care and digital health industry. Utilization adoption is really through the roof with telehealth, virtual care, digital health companies are growing. The digital health space, I think it's really matured, especially telehealth, which, for me, I've been in the telehealth space for 6-7 years now. It's had so much potential. There's been so much fervor in the community for telehealth. And I feel like now, because of COVID and the space we are in now, the potential is finally being matched with demand and value. Digital health, virtual health, it's become mainstream over the last few months. And I would say that it's here to stay now.
For sure. I think it's definitely here to stay. And I hear you because I've also been in the space for over 5 years before it was cool to be a telehealth expert. So it's really interesting to see it transform.
Right. We've always thought this day would come. If you talk to any telehealth stakeholders who've been in the business for many years, we always knew that a day would come where virtual care and telehealth would be mainstream. And I always said it would take a societal change where people now realize these services were available, comfortable using them, or had, a demand to use them. What we didn't know is that a pandemic would make that happen. But it is amazing to see just the validation of this industry and these tools that we knew for many years, finally getting that validation and, kind of in the limelight.
So talk to our audience about the difference between telehealth versus telemedicine.
Pro tip here, telehealth, telemedicine, though it's used interchangeably, they aren't the same thing. Telehealth is a broader scope or umbrella, so to say, umbrella of healthcare services delivered via electronic communication. So think of telehealth as a broader scope. So for example, telehealth can be delivering health education virtually, conducting administrative meetings using electronic communication, proactive monitoring, as well as diagnosing and treating, which is what telemedicine falls in. So, telemedicine, on the other hand, is the actual diagnosing and treating of patients at a distance using electronic communications. And it's important to understand these distinctions because it allows for healthcare organizations to really maximize their telehealth system and use them not only, use them for additional use cases and weave them into kind of their day-to-day administrative and training activity. It's often kind of lost that, it's just audio, video, and diagnosing and treating is telehealth. Also those broader scopes, like I mentioned, administrative, health education, like Project Echo programs, all this kind of falls in that bigger umbrella telehealth, while telemedicine is really that act of diagnosing and treating virtual. So I'm glad you asked that question because that's a distinction that needs to be made often.
Yes, especially with all of the, mass influx of providers that are now doing telehealth, the words are used interchangeably. And I know for us experts, it kind of drives us crazy.
No, I 100% agree, but it's good to make the distinction. Absolutely.
For sure. So payers are kind of all over the place when it comes to their reimbursement policies. What has been your experience and how are you advising clients to deal with all of the variations and disparities?
Oh, man. Reimbursement in telehealth has been a constant battle for over 10 years, right? For many, many years. And these executive orders around reimbursement for telehealth during what I'll say peak pandemic were obviously necessary and changes that, us telehealth stakeholders, we've been pushing for 10 plus years. Am I right, Toni? So,
right.
They really made a difference. And, many are actually now being made permanent, which is great to see, right? Some changes, though, I advise my clients to not get used to, right? And to not create bad habits with. So, for example, like a rule that was passed that you could use non-HIPAA compliant telehealth tools to do telemedicine. And you know what? To me, it's just not best practice. And it really opens up too much liability for providers to use non-HIPAA compliant tools, even though that emergency order allows them. There's so many HIPAA compliant tools out there. There really is no use to use ones that aren't. Also, getting reimbursed for phone call. All right. Many states already have strict prohibitory language around phone-only consultations being reimbursed as telemedicine. Again, with the executive orders, these were opened up during the pandemic, and I've seen way too many providers really get comfortable with this. So I'm really urging my clients, I'm urging them to have these same consultations, but over compliant live audio video sessions, if they're going to continue to be billing telemedicine. Because, unfortunately, I just see a ton of audits, fines over HIPAA violations around telehealth billing on the horizon. I think those are some key points, pro tips that I'll give my clients. From a billing standpoint, variations on reimbursement policies from health plan to health plan have always been there, Only difference now is the influx of claims actually being submitted and paid. My pro tip is to really take a deep dive with each payer and get an understanding of the variations around telehealth billing, the different modalities. And I think one of the biggest things that people get caught up on is the modifiers, right? And which modifiers. So those are a couple of my pro tips around that I give my clients around the different variations with telehealth billing.
Those are great pro tips. So what are your top 3 pro tips for healthcare professionals that are just trying to keep up with all these changes?
Oh, man. I mean, my first pro tip is to stay engaged and educated on the policies, yes, but also the market trends and the technology advance. So I would say one of the best organizations is telehealth resource centers. There's about 14 of them around the country, geographically placed and federally funded to push adoption for telehealth in the region. And they really have the pulse on the marketplace and policies. There's online forums like Startup Health is a great one that really will give you a indication of where the investments are going, startup companies gaining investment. Blogs like mHealth Intelligence is a great one. And communities like HIMSS and the MedTech Twitter world are all great ways to really stay engaged on where digital health is going now, where it is now and the landscape in general. And second, like I mentioned before, I urge providers to take the time to really understand the payer's digital health policies, what roles, these policies and digital health in general play into their organization. I say this a lot with my consulting clients is, digital health isn't one size fits all. These changes will continue to occur and they're going to be critical for professionals to be self-aware, understand what their organization does, what their gaps are, and understand what digital health means and these changes mean and how to adopt them, how to evolve with them. And going into evolution, I think third is really staying open to evolving and innovating. Toni, the innovative or die premise is now truer than ever. Am I right?
Yeah.
All right. So digital health could, in many years could have been looked at, an optional modality, and not really needed or not as critical and core of a practice. But for the provider now, it's vital and it's essential, especially to keep the competitive edge. But now I even say to stay in business, right?
Absolutely. Those are excellent pro tips. There's a lot of independent physician practices that are closing up shop, that are being bought out by the hospitals. What are your top 3 pro tips for independent medical providers to maintain their independence in the changing landscape?
Oh, man. I think the first pro tip here is independent healthcare providers have to learn to market. They have to create a presence. They have to market online, and they have to create new innovative service lines that are patient-centered. When you have patients that are loyal to you and you provide them above and beyond service, they won't leave you. And you'll be able to create additional opportunities with those patient pools. And that goes into my second pro tip, which is own the patient experience. If you look at providers that own the patient experience, provide exceptional service, they can survive because they have the strong patient base that's loyal to them that continues to grow. But the ones that are, lacking in that department and have bad Yelp reviews and don't market online and don't provide, kind of those really in-depth patient experiences, they're the ones that are in trouble. So I would say the next pro tip is own the patient experience, focus on it, tweak it. We live in an on-demand world, so you need to cater to that, and not just saying that because I'm in the telehealth, telemedicine world, but it's just the truth, And I think number 3 is go concierge, seek alternative payment models and look to expand to new regions. With new technologies, you're no longer stuck to one region. You can provide your services abroad. You can cross state lines as long as you get a couple extra licenses. So there's additional opportunities that providers should seek that aren't just traditional reimbursement, but they're innovative revenue models that they can leverage digital health and virtual care tools to establish. I try to tell clients to create service lines using technology, and that opens up a lot of doors, and then it makes you more independent. You're not relying on other resources. So I think that those 3 tips would be important for individual providers.
Yes, I agree with those tips. I think it's all about being innovative and really adapting to the digital age. So what are your top 3 pro tips for clinicians that want to incorporate telehealth and telemedicine into their clinical practice?
I think the first pro tip, and going back to what I said earlier, understanding that telehealth or digital health tools, whatever shape or form you're implementing them, it's not one size fits all. You really have to assess what your organization does, what gaps these tools will fit, and then implement them. So you have to be really self-aware and understand that when vendors try to sell you a dream, okay, don't listen to that dream. Make sure it fits what you're doing, and find true partners. There are true partners out there. I think number 2, and this was something that I really have seen, especially during this pandemic, is healthcare providers looking at telehealth and telemedicine as just audio video live. What providers need to understand is that telehealth comes in a few different flavors, as I call it, or modality. The first one is the most traditional one, and everybody knows it now, obviously, is live audio video, synchronous telemedicine. The second one is storm forward. It's not live, asynchronous, but it also has its own CPT codes, and it also has additional use cases you can use it for: dermatology, radiology, etc. And then third, one that I specialize in, I've done a lot of work around, remote patient monitoring. Again, also have their own CPT codes and use cases. So when I say this and I talk to my clients, it's like, don't look at these virtual care or telehealth in just a singular live audio video modality. Understand how or learn or adapt or implement technologies where you could take advantage of these different modalities of telehealth. Because one, they're all reimbursable in their own right with their own CPT codes now, right? So that's revenue that you're leaving if you don't have the functionality to accomplish these types of modalities. And number 2, you're opening up more use cases, more, back to what I said earlier, service lines, right? So you have an asynchronous service line where a patient can upload their X-ray or MRI to you, and you can review it at a later time and bill. You have a chronic care management program with remote patient monitoring where you're deploying devices to manage patients, creating those service lines to make sure it grows and it is something that is a vital part of the business and it has focus, and it's not just, hey, it's there. It has to become a department, become service lines that create revenue and bring value to the patients. That should be a focus, not just a secondary tool.
Sure. I couldn't agree more. What are you foreseeing the next 1 to 3 years looking like in the digital health space?
I think we're seeing a little bit of it right now. I believe a lot more IPOs. There's a few companies that are going to go public, I believe, in the next couple of years in the telemedicine, digital health space. Also, I think it's continued mergers and acquisitions. See a couple big ones, obviously, in the last few weeks as well. So I think that trend is going to continue. I think we're going to see more niche type of virtual care services. So, like a Roman and more of these niche type of virtual care services. And Toni, the rise of virtual reality in healthcare. It's coming.
Yes.
Okay. So virtual reality. It's a crazy world. I've already been testing, and I work with a foundation called the Virtual Resets Foundation. We donate VR headsets to sick children in hospitals. So I kind of had a little taste in that world. But VR in healthcare and VR in general is going to be, I believe, really in the next 3 to 5 years, the next true wave of digital health to come. So it's exciting, and I think there's so many use cases that we haven't even discovered yet in VR. So I would say more mergers and acquisitions, more companies going public, a little bit of consolidation in the industry for sure, and then the rise of VR.
This is all such exciting stuff, right? Like we're nerding out over here.
Oh yeah, for sure. It's so exciting, especially as an entrepreneur, someone that really believed in virtual care, digital health, I feel like a lot earlier than a lot of people, and really believed in it and said, this is going to work someday. And there are things that like, man, is this ever going to work? And so there's for a lot of my telehealth stakeholders out there, yourself, it's a lot of validation that the tools we believed in so much are coming to fruition and really providing value to our society, helping people like we always thought they would, and really changing the world, and so I'm excited. It's been a 6-year journey, and I think I'm just getting started as well, and look forward to the next 6 to 10 years.
For sure. Absolutely. We've just gotten started. So what is next for you, Aneel?
Oh, there's so much going on. So, my company, we Irfan Medical Supplies Technologies, both core parts of my business, medical supplies and virtual care, have been really booming over the last, few months. So for me, I'm going to continue to automate my medical supply business. But on the virtual care side, I really want to focus more on remote patient monitoring programs. I really think that is the next real big growth in telehealth, remote patient monitoring. So I'll be looking for a lot of organizations to consult with and bring remote patient monitoring programs to fruition. So I'm excited for that, and hopefully doing some more work with Startup Health and other companies, doing some more writing, some more podcast collaborating. Truly, the sky's the limit. I have my first speaking gig coming up here. It was supposed to be in Austin, but now it's going to be done virtually. But so looking to do a lot more of that, a lot more writing. And so I'm super excited. I think looking forward to the growth, looking forward to helping a lot of people, and I'm really excited.
That's what it's all about, Aneel. And I'm excited for the future as well. I know you're going to do really big things.
Yes. Thank you so much for that. Thank you so much. Toni, thank you very much for having me. It's great to be your guest.
Thank you for taking the time to join us today, Aneel. Be sure to connect with Aneel Irfan on LinkedIn. So it's time for this week's coding pro tip, and it's brought to you by Discount Medical Supply Store. Are you in need of PPE? If so, you're in luck. Discount Medical Supply Store has the lowest prices on all your PPE needs, including N95 masks, respirators, and so much more. Visit our website, alphacodingexperts.com, and head over to the Deals and Discounts tab for a link to take advantage of special pricing for all your PPE needs. If you have a coding-related question and would like it to be featured in one of our coding pro tips, please reach out to me on LinkedIn, Facebook, Instagram, or YouTube. So this week's coding pro tip comes to us from Lakeland, Florida. Hi, Toni. The ICD-10 code G31.9, which is degenerative disease of the nervous system unspecified, is giving us some trouble. When would you use this code? So this is a very non-specific code, but the etiology of many degenerative diseases of the nervous system are not fully understood. So for example, there are 2 types of conditions that are classified in this category, and this is per Optum 360. So Alpers disease and Lee's disease, and those are known to be inherited. And this is all per Optum 360 and Coder Pro Expert. So I hope that gives you some insight as to when this code would be applicable. Please remember to hit that subscribe button now so you never miss another episode. Also, be sure to drop us a rating and review on iTunes. We really appreciate your support. So this concludes today's episode. Until next week, thank you for listening to the Alpha Coding Podcast. We'll see you next Monday.
For more information about medical coding and billing pro tips, including how to hire alpha coding experts, follow us on LinkedIn, Instagram, Facebook, YouTube, or visit our website at www.alphacodingexperts.com.